Keep admitting people here as I talk. Everybody, good morning, and thank you for your time this morning. If you could, since there's quite a few people on this call, go ahead and mute yourselves just to decrease any background noise. Just so you know, we are recording this meeting, so that way it's available for you to review throughout the year. And it's also available for new hires to look at as well. So you are welcome to stop at any time and ask a question. So feel free to do that, but just know that it will be on the recording. Obviously, we can chat afterwards after the meeting. As you see on the screen here, this is the Shally contact sheet. Feel free to give us a call with any questions, email us throughout the year. We're here to help you. So thanks again for everybody joining us. This is your open enrollment period. The time around July 1st when you have the opportunity to make changes to your medical benefits. Still two fantastic plans being offered by CSO. As you saw in the email that went out, there are no changes again to the plan this year, which is fantastic. No changes to your contributions, which is fantastic. The main reason why we're having this meeting is because we are utilizing an online enrollment platform called Bernie Portal to basically streamline the enrollment and open enrollment process. It gets rid of all the paperwork, all the forms that you have to complete and submit. So you can really streamline the process here. We're trying to make it a lot easier to complete open enrollment documents throughout the year, and then also be able to access open enrollment documents throughout the year through the Bernie Portal site. So the goal of today is just to do a very brief review of the Geisinger Health Plan benefits, because they really have been the same for the past few years. And then jump into Bernie Portal. I have a PowerPoint to go through step by step that will basically show you exactly what you're going to experience. And it won't take too much time, but I wanted to spend most of the time on that Bernie Portal process. So again, this is the open enrollment period, your time to make changes to your benefits, add, remove dependents without a qualifying life event. You can do that now. You can switch plans as well. As you know, there are two plans being offered. So if you are in one and want to change to the other, now is the time to do that for a July 1st effective date. Okay. So for the sake of time and convenience, I'm just going to say that both of these plans are exactly the same, except for the deductible. So you have the choice of having either a $2,000, $4,000 deductible or a $500, $1,000 deductible. But outside of that, these plans are exactly the same. So I'm going to briefly go down through the similarities, and then we can move on to how you get enrolled into Bernie Portal. Okay, so preventive services on these plans are covered at 100%. Co-pays that apply prior to the deductible. So from day one, the deductible does not apply. Primary care copay is $20. The extra site copay is $10. So as most of you are aware, if you utilize a doctor that is in Geisinger Health Plan's extra site network, you pay only the $10 copay. If you see a primary care doctor that participates with Geisinger Health Plan but is not on one of these extra sites, you would still have a $20 copay, which is still great. Okay. Most of the primary care doctors in our area are now in the extra site, so most of you should be paying only $10. Specialist copay is $40. The telehealth services that some of you may or may not take advantage of. You could save some dollars from a copay standpoint, $5 on a primary care, $10 on a specialist. in order to access the telemedicine services. And again, I should say all of these things that you're seeing, these flyers and these forms, they're all going to be in Bernie Portal that you can download and view at your convenience. So you all have these forms. But to telemedicine, to access that, you can easily call their hotline and get started. You can see if your doctor or utilize one of their doctors for their virtual health visits and save a couple bucks. You don't have to go to the doctor's office then. Obviously, you're doing this from home remotely. It's just a little bit more convenient. So $5 primary care, $10 specialist on those copays. Urgent care copay is $20. Your ER copay is $150. We always encourage individuals not to utilize the ER as their primary care doctor. Go to the ER only if you have to, if it's an emergency situation. If it's non-life threatening and it's outside of your primary care doctor business hours, utilize the urgent care facility. Significantly less copay to you at $20. That's why the urgent care copay is so low. They want you to go there instead of utilizing the ER. Just use the ER, like I said, life-threatening situations. Your rehab copays for physical, occupational, and speech therapies are at a $40 copay. Your outpatient mental health and alcohol and drug abuse is a $20 copay for those services. Prescription drug copays. You have your standard 3-tiered network of prescription drug copays. Your tier 1 is $20. And that tier 1 is most of your generic medications that don't need a doctor's prior authorization. Your tier 2 is $40, and that's the generic meds that do require prior auth, and some the brand medications that don't have a generic equivalent. So those are the tier 2 $40 meds. Tier 3 is $60. Those are your brand name medications that do have a generic equivalent, but you choose to take the brand medication, you would pay $60 copay. And that's for a 34-day supply of those medications. And I should stress, under the tier 1, the $20 copay for a generic medications, that's the most you would pay. Most generics don't cost 20 bucks, but you would just pay what the cost is at that point in time. As most of you know, I'm sure, Geisinger Health Plan's mail order pharmacy is very convenient. You can save some dollars, get your prescriptions that are available through this program, through the mail, at a 90-day supply, and save money on your prescriptions. Their mail-in orders pharmacy is in Elysburg, so it's right in our backyard. If you're not set up with them already, all you have to do is dial that phone number, call them, and their pharmacy team can get you set up with their mail order pharmacy program. So take advantage of that if you can. So those are all the copays that apply before the deductible, or they don't apply to the deductible, so they apply from day 1. And they're exactly the same on both plans. So the things that do track towards your deductible are diagnostic services like your labs, x-rays, high-tech imaging, things of that nature, outpatient and inpatient facility and physician fees, durable medical equipment, things like that. All of that tracks to that upfront, either $2,000 or $500 deductible. After that deductible has been met, then Geisinger Health Plan covers 100% for those services, as long as they're in network and a covered service. You would not have any more deductible related expenses. Both of these plans have an out-of-pocket max of $9,100 per member, or $18,200 for family. With the way this plan is set up, or these plans are set up, you'd have to have a lot of copays going on in order to hit that out-of-pocket max. So it is possible to hit that out-of-pocket max. It's not probable, but that out-of-pocket max is there as your safety net in one benefit year. You would not pay more than that. So that's just a really brief, quick overview of those plans. I wanted to keep it brief. They've been the same for quite a few years now, which is fantastic. It's not very common that a group can do that. So that's great that you're able to have these two plans for so long. I'm going to keep rolling through, and just one more site here, or flyer, before we go to Bernie Portal. Just remember to set up your Geisinger Health Plan member account. Okay, go to geisingerhealthplan.com, use your member ID number, set up your account. You can have access to all of your explanation of benefits. You can see all of your claims. You can make sure something was applied or a claim was submitted to the plan. You can check out the formulary to see what tier your medication falls under. You can also take advantage of their health and wellness programs and healthy rewards programs to get some money back and things like that. So you can also view and print your ID card if you happen to need that or lost your ID card. So please go to geisingerhealthplan.com. If you haven't already, set up your member account. If you have it, it will roll over to the new year. You don't have to set up a new account. You may have already received ID cards in the mail, new ID cards. If you haven't, you will. The member ID number is the same, but it's just new ID cards that you can start using July 1st. And that's about it for Geisinger Health Plan. So that was a really quick and brief review, and I am going to try to get this PowerPoint up here. Okay. Now, as I said in the beginning, instead of the benefit election forms and the enrollment change forms and all of these things for the medical plan, and then eventually for the dental and vision later on in the year, we're going to utilize Bernie Portal. It's a fantastic online space that does a ton of stuff, but right now we're just going to use it as the enrollment platform for individuals to make their elections each year during open enrollment. Okay, so after this meeting is done, we'll email out, or Carolyn or Megan will email out to everybody this flyer. This flyer will also be available to you on Bernie Portal if you need it for future reference. But this is how you log in for the first time. You'll go to the website and use the credentials here. Let me go back here, and it's going to go like that. You go to the website, it's going to look like this, Bernie Portal. You're going to go right here with that circle, log in with employer code. This is when you log in for the first time. The next time you log in, you will have already created your username and password. Your username will be your email. Your password will be whatever password you pick. And then for future times logging in, you just log in normally. For the first time, you go to this page, you go to the employer code login. You're going to enter in right here. It's going to take you to this screen. The first 2 digits of your birth month, the last 4 digits of your social, and then the employer code that's specific to CSO. So everybody has the same employer code, obviously. You all will have different birth months and last 4 of your socials, obviously. But that's how you are going to log in for the first time. So we have preloaded some of your information in order to allow you access to the Bernie Portal website. You will have to complete some more information once you get in there. But the first 2 digits of your birth month, the last 4 of your social, and then that employer code. And then you'll hit login. And that's going to take you into the Bernie Portal. And if you didn't notice, you could probably see it up here in the upper left-hand corner. The mascot for this is a Saint Bernard. That's why it's called Bernie Portal. If you if you wanted to know. Anyways, this is what it looks like when you're in there. You're going to complete these steps. This is the process of setting up your user ID and your password. Your email address is going to be your user ID. Set up your password that meets this criteria, and then create your account. Okay, very basic stuff. Now, on this is going to take you to some of the information that needs to still be completed. So you're going to enter in some of your demographic information, your socials, your dates of birth, things like that, your contact info, your address. All of this needs to be loaded in, because what Bernie Portal will do is when you go through the application process or the enrollment process, it will pre-fill the Geisinger Health Plan enrollment forms. It will pre-fill the change forms. When we get to dental and vision, it will pre-fill those forms based off of the information that's in here. So whatever address that you put in here, or the dates of birth and things like that, that's what's going on the forms, and those forms are coming to us. So that way we can complete the enrollment process. All right, so it's all done through Bernie Portal. They pre-populate the forms and then they come to us. You can also add a fun photo if you want. You don't have to do that, but that's the basic upfront demographic information that you need to complete. Once that's done, you'll go on to the next page, and you can see that it's yelling at you. It says you have not completed your enrollment. You're going to click the blue button that says Begin Enrollment. Right here are the open enrollment notices that you typically get every single year. It's a chunk of paper that most people just throw away. So we're trying to save a few trees. You can download and look at all this stuff. There's nothing here that you have to download and complete and hand in. This is just information for you about open enrollment notices and the standard regulation notices that need to be given out to you each year. So you can download them if you want. If not, save and continue and move on. You have the option to add spouses and dependents in Bernie Portal if they are going to be on the medical, dental, or vision benefits. Again, right now it's just medical. Down the road it will be dental and vision, but if they're going to be on those benefits, you need to turn those on and then save and continue. Put their information in. You can add as many dependents as you need to. Okay. And then keep going. And now right here is where you are going to be electing the benefits. So you've just entered in all of your demographic info, your family info. Now you're going to be looking at the benefits. This is going to be specific to just the medical right now because the dental and vision is turned off. This drop-down tab will give you the option to select either the $2,000 deductible plan or the $500 deductible plan. Depending on which plan you choose, will change these attachments, some of the attachments down here, but you can look at the benefits summary. You can look at the extra form that I referenced earlier, the hospital network, so on and so forth. Some low cost provider information like utilizing Quest Diagnostics or Susquehanna Valley Diagnostic Imaging, your preventive services flyers. All of these things are available to you, and you can log into Bernie Portal throughout the year and grab this information as well if you want to, but you can view that stuff right now. So again, up here, choose your plan. Below the flyers is your cost. Okay, so you'll see that there is no change to your cost per pay period. Elect the tier that you want for the medical plan, whether employee, spouse, child, children, family, so on and so forth. And that's going to give you your cost per pay period down here, depending on what you select. Save and continue. You have the option when it comes to family to enroll everybody or just some of the people, because in certain circumstances, there might be a dependent that you want to put on the dental and vision, but you don't want to put on the medical. So it gives you that option to check or uncheck those individuals. Save and continue. And then that's it. You're at the end here. You're checking a couple boxes here. You're going to sign your name here in the box and then click agree. Up here, it's going to pop up that says you are about to sign. Press OK. And that's it. So very quick and easy and simple, streamlining the process, keeping everything online. You can log into Bernie Portal at home, obviously, if you're on vacation. It solves a lot of the problems of getting paperwork submitted in time to everybody. So if you have any questions with Bernie Portal, let me get out of this real quick. And show. Again, reach out to us. Holly Troop here in our office is basically manages the Bernie Portal sites for all of our groups. So she's really the go-to if you have any specific questions. If you're in there and you need help, or if you have a question on anything Bernie Portal specific, she can help with that. Anything benefit related, obviously I can help with that. But it should be a pretty seamless process. So after we're done here, as I said, the Bernie Portal how to log in form is going to be emailed out to everybody. Please go in as soon as you can just to make sure everything works okay. If you have troubles logging in, reach out to us. At this time, if there are any questions regarding the benefits or Bernie Portal, you're welcome to unmute yourself and ask anything.
I think there's 2 questions in the chat.
2 questions in the chat. I'm going to unshare my screen so I can see the chat. Okay. Did I stop sharing my screen? I think so.
Yes.
Chat. Okay, so a question about a social security number. Is the family social security number needed immediately when filling out the paperwork? No, not immediately, but if you can get that to us, that would be great. If you're already enrolled in Geisinger Health Plan, Geisinger Health Plan already obviously has that social security number, so it's not a huge deal, but you don't have to put your family social security numbers in Bernie Portal if they're already enrolled in the plans. If they're not enrolled in the plans, we need to get that information somehow, whether it be through Bernie Portal or calling us with the information, things like that. So another one, what if you're opting out of coverage? So yes, that's a great question, and I didn't hit that on the area where you can elect your plan. There is also going to be a spot to waive coverage. If you elect waive coverage, it's going to take you right to the end to sign and finish the process. So you still have to go in. Please put your name in. If you're waiving coverage and you don't want to put all your demographic information in, you can put fillers in just so you can complete the process. That's fine. But again, please remember, we're using this for dental and vision as well. So if you waive the medical, but you use the dental and vision products, you're going to want to make sure the appropriate information is in Bernie Portal. But yes, you do have the option to waive the benefits as well. 2 good questions. Anything else? Carolyn, Megan, do you have anything else to add before we stop recording and wrap it up?
No, I just wanted to thank you, Tony, for the overview and your time today. If anyone thinks of any questions after we hang up, feel free to reach out to either Tony or Carolyn and I, and we'll be sharing the recording so that you have it for your reference in the future. Thank you, everyone. Have a good day.
All right. Thanks, everybody.
Take care.
Thank you.